Whew. Hello, everyone. Happy Sunday. It's exactly 5 o'clock. Um, say hello, say hello, say hello, say hello. Type in the chat box. Tell me who's on. Tell me who you are. Good evening, all. Thank you. Let's start going. How are you all doing? The first 5 minutes we get to know each other. We get to say hello. We get to just be happy. So that's today. Here we go. Today is another day. Today is the second Sunday in August. Wow, the year has really gone. To everyone joining me for the first time, my name is Dr Denise Ejoh. I'm the CEO of Como Cancer Foundation. I am a cancer patient advocate. I just realized today, and I think somebody on this platform will help me confirm it today. I just checked the day we got the results at the hospital in Lagos, and I'm sure that it was Tuesday, not Monday. They told us to come on Monday to come and collect the results, and we got it on. We had to go back again on Tuesday. Yeah, we got it today. I've checked it. Today is the 9th of August, 2016. I had a paper in my hand that said I had cancer, and I refused to read it. Hello, everyone. Hello, Dr. D. Hello, Stan. I went to look at the calendar to check that and see what's going on. Try and remember whether it was today. It is today. 10 years on. I think I don't look it. And I'm grateful I don't look it. I am grateful I don't look it. So, to those of you joining me today, welcome. If it's the first time, hello to you. If you've joined me before, this is Dr. Denise Ejoh, a 10 years metastatic breast cancer patient with multiple brain surgeries and multiple. I don't know what I have left in the brain as I talk to you now. All I know is I take chemo every day. But let's sit down. Let's have fun. Let's have fun. You say I laugh about this. I laugh intentionally because I refuse to go down. So I'm now ready for you. Let's start chatting. Those of you online, hello. I have a strange feeling, if I am right, that the new Nigerian is, if I am right, I'm going to say the person's name, but the person is, if it's the person, just it's David. If it's David, just say yes. Just put your thumbs up. I have so many Davids in my life, but I think this particular one is David. Hello, if it's David, and if it's not, will be your name so I can. Clap for me. I got it. I got it. I got it. I got it. See, I'm making progress. I am making progress. Hello, 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 hello. We normally give people the first 5 minutes where I chat all the things I want to chat about. So, oh yes, please share, 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 share. Let people come online. Let's listen. Let's talk. Let's just be fair to ourselves. It's nothing much, nothing sensitive, nothing untoward. Just the title is the checkup challenge, and it's going to require you to do a lot of reflection for yourselves. So please always be aware of that. It's about you, it's not about me. It's 25 minutes of talking, and you're going to be doing your challenges yourself. I'm just going to tell you what you should be challenging yourselves on. So make sure you are well and truly ready for this. I've got my daughter on. I've just got my daughter on. Oh, that is nice. Thank you, thank you, thank you, thank you. My goodness. Uh, so let me see if the other one will join me. Eventually, she should. I hope she does. She's supposed to come on as well. So, how many minutes have we got left? We've got seconds. We've got seconds left, and then we're starting. So, invite your friends, invite your friend, invite anybody you know. Let's all have a chat. It's called today's one is actually it's not about me. It's called the checkup challenge. The checkup is not about me. Me and checking me up. It's about you. So, if you're joining me for the first time, I try to use a lot of Nigerian lingo because they have so many. I would say we have so many uh, um, jokes and expressions that the world takes on board. So, yes, let's go. I am good to go now. Let us go. So, where are we? Welcome to today's program, the Check Up Challenge with Dr. Denise Ejoh. How often do you usually stop and ask yourselves, when was my last checkup? I'm asking you a very serious question today. For many of us, we only think about our health when something goes wrong. We ignore a symptom, postpone an appointment, tell ourselves we're too busy, or simply, I feel fine. I hear that all the time. Please, I'm not an exception to that rule in family and in my friends. But today we want to challenge that mindset, and that's the goal and that's the hope. A health check is not about waiting to become sick. It's about taking responsibility of our health, knowing our risks and paying attention to changes in our bodies, and seek medical advice when we need it. If we get advice on time, we are more likely to get through it, get through whatever we face going forward. So today, my name is Dr. Denise Ejoh, and I will be talking about the checkup challenge, why we delay, what we should pay attention to, the importance of screening and early action, and how we can encourage our families and communities to take their health seriously. So let's go. My opening question. And if you can, please now use this chat box to start responding. If you remember, if you don't, write it in your own notebook. I'm going to give you time. I said today is checkup challenge, and let us go. Why is checkup challenge important? What do you think it is? Why do you think it is? I'm asking you. If anybody can answer me online, just tell me. Why do you think it is? Why do you think it's important? Why do you think many people avoid going for health checks when they know they should? I will give you I'm not giving you statistics because I'm not a medic. I always say that and I own up to it. Many people don't engage in checkups because they're afraid of what is going to be said. Sometimes there's nothing to be said. A lot of the time, there's actually nothing to be said. And if there are warnings, those are when you know about the warnings. You don't want to be told that you already have an illness when if you knew something was already wrong. And that is what a checkup challenge is, even when you know you should just do the right thing. So let's explore the reasons why you do it. The reasons why we go through it is fear of discovering something is wrong. Standard. A lot of the time is about the cost. And that's very common in low middle income countries, or places where you have to get insurance and you don't have insurance. But in the UK, anybody that says that is not fair because we are entitled to a full medical check every year, once a year. Just submit yourself and say, I'm coming in to have my yearly check. And you don't have to come back again in a year's time. Trust me, you don't. But if there's anything, they'll find it in time. You look at the cost. So there's no cost if you're in the UK and in many countries across the world. Another one that we keep hearing is lack of time. Make time to live. You have to make time to live. I can't help you make time to live. So when you know that you're due, find the time. Is it just to go and take your bloods, take the paper, go and do your scans, x-rays if they have any to do, and go home? But just decide and do the right thing. So I'm getting good chats here, and I'm going to actually refer to it a lot today. Assume I feel fine. A lot of the time you do feel fine, and I'm going to give it data today. Cancer is an everyday sickness. So it is a headache. It can be a headache. It can be diarrhea. It can be constipation. It can be stomach pain. It can be cramps. It can be your leg. It can be a small boil. It's something that looks like a boil. It can be anything. It's everyday things in you or around you. But until it's checked, you do not know what it is. Fear of the hospitals. And now I'm giving you one, and my children, I hope they're both here. I have two daughters. My daughters are my, if you're looking for champions, my daughters are my champions. My son's my champion. My daughters, oh my God. My favorite champion is my granddaughter. My eldest daughter does not do hospitals. My younger daughter did all the hospital appointments. I've been here on this journey for 10 years. 10 years today. I think around 4 o'clock, I was told. I didn't hear. I just looked at the paper, saw it. I think it was either in the morning. I think it was in the morning actually. And I didn't know what to do. Self medication, we're very good at it. Oh my gosh. Terrible. We're very, very, very good at self medication. Or we're waiting for a symptom to be severe. So let's go. Ignorance is also a major factor here in Nigeria. I agree with that. But there's a biblical verse that I always hold on to. It says, "My people perish due to lack of knowledge." You always say you don't know, or you pretend you don't know, or you say it's not my portion. So you have excuses. Oh my goodness, it cannot be an excuse going forward. So, do you think sometimes we are more afraid of the diagnosis than we are of the disease itself? Tell me. I'm asking a question now. Do you think sometimes we are more afraid of a diagnosis than we are of the disease, the cancer disease itself? While I look at my chart, Princess says we check up at least 3 months, 3 months in a year. Oh wow, that's interesting. I'll be afraid to do that. I don't like doing I don't like doing my what's my scans. There's a scan I do every 3 months. Honestly, it gives me severe anxiety. What's that one? My brain MRI. Have to do that 4 times every 3 months. My goodness. No, I don't like it. So I don't think I will cope with that 3 months a year. I haven't got any answers. Have I got? I've only got stands. I think that stand that says ignorance is a major factor on why we don't do it. But that's about it. Okay, so let me give you this allows you just to bring in my own experience. I'm going to tell you some facts about my journey now so that we all get it. Um, I was diagnosed 10 years ago in Lagos, Nigeria. They didn't tell me what I had. They just said that I had cancer. But what kind of cancer they didn't that wasn't said. The paper said something about 3 months to live. And and I was planning, and some my doctor that I spoke to at the time said he could arrange for me to go to India. Well, you see, as I said, I'm a dual national. I say God loves me too much. And I flew out of Nigeria at the weekend. So it was a Tuesday on that time. By Friday, Saturday morning, I was on the Arik Air. At the time, Arik used to fly. I think it was Arik, Arik or Air Nigeria. I think it was Arik. Anyway, I was on a flight back to the UK. I had my plans, see the doctors, everything will be fine. You know how you lie to yourself. You know you're very sick, but you're lying to yourself. Lied to myself. My daughter, my youngest was staying in Nigeria. She said she didn't want to come with me. I was so I'll be back in 2 weeks. I was talking nonsense. Even if I should be honest, I knew I was very, very sick because I didn't even know how. I was afraid that they should not stop me getting on the flight. And then luckily, as I entered the airplane, I now met a friend who mine was on the flight, and she was sitting. So I went to sit. We sat together. I was like, thank God. So at least I have somebody. As I was coming off the plane, I had my daughter and my brother were there again. Oh my God. It was like God was following me all the way. So I was diagnosed eventually a brain surgery within by the first week in By the first week I was hospitalized immediately on the Monday. So the Monday of that week of the 9th, I was hospitalized. I stayed in hospital for the week because my head, the swellings in my brain was very severe. And then I went back home when it has stabilized, and I was programmed to have brain surgery as soon as possible. And had my brain surgery on the 11th day of September 2016. And I walked into the cancer center towards the end of September. And that was how my journey started. Because when I look at my personal experience and the treatments, my body was talking to me. But you see, the first things we talked about, and I'm going to reference them again, I was no different. Fear of discovering something was wrong. Oh, yes. I just said the cost. Um, yes, the cost. Yes, the cost. I remember because we first had to go and make sure that I had enough money to pay for the scans. I was paying for hospitals left, right, and center. Then I had to now pay for scans, and then I was giving money to pay for my scan. Then I came out with that one, and then they're telling me I have to go to India. I'm thinking, I'm going to England, so I have to pay for that one to get to the UK. And then I'm starting thinking about how I'm going to go back to Nigeria because my youngest was going back to secondary school in September, and I had to get her back in school, and that was never going to happen. But in my mind, I thought it was going to happen. You can see me, I'm waffling. I detest MRIs. I won't even want my enemy to do it. I don't blame you. I do it every 3 months. I've done it every 3 months for the last 10 years. I have a heart scan every 2 times a year. I have a CT scan twice a year. I have a bone scan once a year. And they've just added a new one. I don't know if it's once a year yet. So I don't even want to know what it is. So let's start with the questions. This is where we are, and this is my story. And I'm not talking about my story. I'm trying to tell you why you should encourage, you should listen to your body. That's what I'm trying to say. So if so, for me to tell you that my experience 2026 and where I am today, what I know today and what I knew in 2016 are two different things. In 2016, if I had been told I'll be here in 2026, I would tell you it's not possible because medical science didn't even give me hope that I would even finish that year. So let's be honest. I was just following instruction with a very positive mindset, trusting God all the way. One of the things that you say that I get a question, how did I get into advocacy? I got into advocacy because at the very beginning, when I realized I was very, very, very sick, I asked I asked I asked God that if I was going to live, He was to show me what I was to do with it. If I wasn't going to live, He was not to allow my children to have to struggle every time for lack of the word, take him into hospitals. And I'll give you an instance. My mother had died a year before, and I watched it, and I was very broken. So you can imagine, and I think I knew when my mom was sick that I was very sick, and I think I knew that those were the warnings that were being given to me for when I was sick. So it was like I say, your body will tell you, and that's I think fundamentally what formed the notion that I would do advocacy. So that was the first thing I said to God. And I'm going to own up. I am all sold out for my God. So nothing you say, I don't live. I live because God has allowed me to. And one day we'll talk about faith. But God has allowed me. My God is the reason I am alive. So there's no need. Medical science, yes, and that's 30% of my life. The remaining 70 are everything else. And that's how advocacy came. And then one day when I was sitting on my chemo chair the following year, I I was sitting with friends who came to see, a lot of people supported me. Oh my goodness. Um, and they said, I'll register an NGO for you. And that was how we started. And that was the birthing of Cornwall Cancer Foundation. It eventually finished, the whole registration process finished in 2019, but you can imagine I was not there. So I'm not saying that every symptom means cancer. Please, that's not what I'm saying. I am saying that we should not be ignorant when we have unusual changes. That's all. Anything that is persistent, I'm standing on it. The one that even bothers me the most is diarrhea and constipation. You know, and for men, you're prostrate. You know that you're struggling to wee. Why are you wasting time? Then it's when they now want to remove everything, you're now yari. No, you can't do that. When do you seek professional help? Find a doctor that, if you don't have doctor that you don't like, if your doctor you don't like, find your friend now. Find a friend. In my class and in my one of my federal government colleges, that the federal government college I attended, we only have one medical doctor. Okay, I did tell with us. And my other school girls school that I attended, they are one of my greatest group of champions. I think they're like 5 or 6 in our UK group alone. And trust me, if they say let's travel, I don't even think it, because I know that they're all sitting there, they're all there. So if I can say I've got pain, the best there's somebody there I will talk to. If they say I've got if any type of anyone, the dentist, everyone is there. So you can see how your communities help. So I want to go back to is the man here now that said, when people have the attitude of letting sleeping dogs lie, oh yes, please don't let sleeping dogs lie. Please, I beg you, don't let sleeping dogs lie. That's believing that what you don't know will affect you. Please don't do that to yourself. I beg. I didn't do it to myself, so I don't even want to advise you to do it. And when I talk again about health check, let's go to what are we actually asking you to do. So what do you think I'm asking you to do? Write me, everybody, try and write me. You got quite a few people. Just write one thing you think I'm asking you to do. Just write one thing you think I'm asking you to do. One. It doesn't matter what you think I'm asking you to do. But it's about you. It's not about me. So you say, I love this platform because I don't have to know who you are. Some people I know who they are, and some people I don't. But write what one thing. So I've got one that says it's not in his DNA. It was not in his DNA. Okay, so I'm going to correct that, the myth, and we're going to come back to that. Okay, so let me be answering it while other people write that. I want to correct this notion. Everybody created by God living on earth is born with cancer cells in their body. You're born with it. The question becomes, does it activate? And even if it activates, you can sort yourself out. No, don't waste time on this program. So I'm going to the next one. So DNA, please, everybody has it. It's whether it activates. So let's look at your routine health check is one. Your BP. BP is a heavy killer in low middle income countries. At least I know in Nigeria, BP is a very serious killer. Please, can you be checking that? And your basics. If you do your test, I don't know. Maybe one day we'll find a way to start giving out BP machine. You know those small ones that are just stick in your hand. That I think they say it does all of it. Maybe we can get sponsored to get someone to buy it and then we give them out. I don't know, because this cannot be killing people. It's too much. Know your medical history. I find a lot of people I've spoken to who don't know that they have family members who have had cancer because we're hiding. Parents, children, please know your family medical history, because once you know, there is a breast cancer gene apparently that is hereditary. The prostate cancer people, you're just boys, you have their things, their genes. Just know it, and then it will help you. Lifestyle and your risk factors. But above all, it doesn't cost very much. Just get screened. That's when you do your medical check, do your screening, and be happy with it. You want me to do regular checkups? Yes, once a year. Once a year. Basic. If you're a man, do what's it called? your PSA and your blood. You do your blood. I think I don't know which country you're in, but I think your blood, your PSA, um, and your full body just check. It's not expensive to that level. Instead of buying one sweet or one outing or one ashwabi, use it to do that. Forfeit that and do this. Good evening, sis. Well done. Thank you very much. Oh, that's Anastasia, I think. Somebody else has said cholesterol is also a silent killer that sometimes goes unnoticed. Therefore, regular checks and knowing your numbers is key. You see now. You see the word knowing your numbers is key. Ask me now, champion. I don't know. But I do remember, my daughter is online, she knows. Please, can you just type yes? I have the machine upstairs, right? I think I have the machine upstairs. Just one of my children just type yes, you have the machine. I have to learn to start using that. Yeah, but just do the right thing for yourself, please. Follow up with abnormal results. I am now baba of reading blood test results. Up, down, cholesterol, left, right, red line, amber line, green line. I know how to read those things. If I see it, I know the answer. That's what you're supposed to learn. Ask the doctor when they're giving you, what's this mean of this? What's the meaning of this thing? Because when you know how to solve your problem. It's your problem. It's not their problem. It's yours. So please do it. Seek professional help. Seek help. I beg, please. Ask for help when you need help. What I know today, I knew I was sick. I can't lie. I knew I was sick. But I have a rare disease as well. We're about 200 in the world, 250 in the world. I am currently the longest living person in Guys and St. Thomas's, 10 years on. And we're only 3 of us alive. So I do know I have a rare disease. But even then, please, please ask for help. Important distinctions that I want us to talk about. There's a difference between screening and going to your doctor. Screening is different. Those of you that live in the UK, you know, they send us bowel screening, HPV, there are plenty screening. There are plenty screening opportunities. They are based on your age. If it's for men, they have prostate screening at a particular age. If you're a black man and you're not a black, there's screening. In Nigeria, a lot of people do screenings, screening and on charity days or fundraising days or medical days. Go and attend it. When they have given you the result, then you go back, and if you now need help, then you've got something to start with. But don't say I'm not going for screening. Go for the screening. If you can't afford your medical checks, then go for your screening. Because there's a lot of screening that goes on. The problem with the screening is a lot of people don't want to read the results because they're afraid of they don't know how they'll get the money to pay it. No, you have to do things right. Yeah, balance your equation very well, please. Okay, I see here somebody else says you've been stressing PSC and BP. Are these the only ones men should focus on yearly? I'm not a man and I'm not a medical doctor, so I really will not tell you what you should. I would say to you, you should do your your medical test yearly. That's what I will say to you. I say men because statistically, in developed countries, that is developed countries, 60% of men still die of prostate cancer, even though they live in countries where medical is available. So, if that is the case in countries like the UK and the US, then you know that in Nigeria and low middle income countries is higher. That's why I go on men, because I always beg men. Women, we don't waste time. They say you have breast cancer, we just cut the breast, we move on again. They say you have, we cut, we move again. You know why? Because we women will always look at it and we're calculating our children. But men, you are slow. And then by the time it gets to the bus stop, we don't need that. We as women, we want you to be there with our children. So that's why I keep emphasizing men, please. So it's not personal. Screening can be offered to people who do not have symptoms, but it depends on your age, and it depends on your risk, and it depends on your sex. So it depends on what they're screening for. But the screenings that I've done bowel screening. The next one I have, I think, is in 3 years. I did another screening of recent. I don't remember what it was for, and the next one is in 2 years. You just do your screening now. Cervical cancer people, do your screening. It's HPV, just do it. Just take your vaccine. Just do the right thing. But what you should not ignore when it comes to specific cancers, what kinds you should not ignore. Please, 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 please. I want to check my time. I got 5 minutes. I got somebody that says discuss with your doctors. Routine checks are very key. Please, other people help me to respond because this conversation is very serious. So the things that are unusual for you that I want you to be aware. Any unusual lump. Let's look at cancer now. Lumps. External lumps should be checked. For breast cancer, it's normally a lump. You feel it. For prostate, it's not lumps. I don't think it's lumps, but I think they say it's to do with your testicles. But there's testicular. I don't know how to pronounce the word cancer. There are different types. Like I said, it's every part of your body. Unexplained bleeding, that is linked to a particular cancer. Persistent pain. One that I know is generic for all cancers. Loss of weight is generic for all cancers. We start losing weight, you start getting tired, you get very, very tired. I'm always tired. You get tired. There's a change in the way you do things. I don't hide it. I take 4 different I take morphine, I have a fentanyl patch, I take cocodamol, and these are my daily painkillers. I'm doped up, right? If it's for breast cancer, it's to do with your breast. If it's bowel and bladder, it's the habits, like I say, diarrhea, constipation. If it's a mole in your skin, yeah. If it's a lesion, they're all different kinds of cancers. Mine is headache, and headache is neurology, and I've had 7 brain surgeries. 7. So having one of these symptoms does not necessarily mean you have cancer. You can have, what do you call it? You can have a tumor in your brain that is not, that if once they remove it, it's gone. You're good. You're good to go. You can have a lump in your breast that they will remove it, there's nothing there, and you move on with your life. So please don't assume that because you have any of a lump anywhere in your body means that you automatically have cancer. It doesn't. It doesn't. But get it tested. I have a young lady. I don't even know if she's on today, and she did the right thing. They went to the hospital. They removed the lump. I don't know how medical doctors did what they did, and they gave her a lump to go home instead of getting it tested. And that was a mess for her. Next time, for everybody here, if you do that, don't let it go home with you. Ask them. And once they touch it, then they've messed it up, so it cannot be tested again. But that's the recklessness of some people. Okay, be persistent. Don't agree if you know there's something. I know there's an issue with cost, and with cost, I'm going to come back to cost another day, because cost is a very big discussion. And I will see if we'll find somebody who can help us talk about cost. But for that, I want to say today, I'm going to say to you, the earlier you know what you are dealing with, I beg of you, the better it is, and you begin to make informed decisions about how you want to navigate what you have left to do. That is my stake today. I'm going to look at some of the questions. Somebody said I should please emphasize the importance of amino acid supplementation. I don't know what that is, so I wouldn't know how to say it. So if you write what it is, then we can look at it, because I don't even know what it is. So I won't. If I don't know something, I'm not going to say it. Write it there, and then we can read it. Catching prostate cancer early for men, yes, it actually saves men's lives. That's the one that I really have a problem with, because I can't. My brain hasn't gotten around to it. But to those of you who are concerned and you're a man on this group, please just look through my YouTube channel now, and you can find. I think there's somebody called Dr. Yates who's on. Look for him and listen to his chat. That was 2026, and see what he says. But if you're looking for different types of cancers, you should find some information on my YouTube channel. I've given you a lot today. We don't spend more than 30 minutes. We're done. I want to thank you all for joining me tonight, this evening, to talk about your checks. I will come back to this check thing. It's quite regular, so don't worry about it. We're on every week now. And let's look at how we navigate going forward. And as I end this, I want to say to all the cancer patients out there, we're going to celebrate. You're going to celebrate with me. In the UK, those of you that are around, I'm going to try and look for those that will go with me when I go to go and do my giveaways in the UK. And in Nigeria, my cancer patients will go with me to go and will raise money to go and do giveaways. If you want to give away, if you want to support us, please look on any of my YouTube channels and help me raise money to give cancer patients some cakes, food to eat at the at clinic. That's what I'm looking for, is food for cancer patients to eat at the clinic, because that is one of our biggest things. Cakes, drinks to have in clinic one day in August for her to mark 10 years of God keeping me alive on this journey. It's not by power, it's not by might, it's by the grace of God that I am alive, and I am very grateful. So to you all that are watching me, thank you for joining me. I look very fine today. Even me, I'm looking at myself and wondering. I want to say thank you for joining me. I hope you have enjoyed this conversation, and I look forward to us doing things going forward. And let's see what we have to talk about next week. Caleb will tell us what it is. I don't know if he's going to type it today, but it's nice having you today, and have a good evening. God bless you. God keep you. God make his face shine upon you. Amen. Thank you. Good night.